My name is Dr. James Harrington, and I'm a well-respected surgeon with over 15 years of experience. Despite my long and successful career, there is one day that haunts me. A day when I made a terrible mistake. It was a typical Tuesday morning at the hospital, and I had just begun my shift. The sun was shining through the windows, and the smell of disinfectant filled the air. I was scheduled to perform a routine appendectomy on a young woman named Emily. I had performed countless appendectomies before, so I was confident that everything would go smoothly. As I scrubbed in and prepared for the surgery, I couldn't help but feel a sense of unease. I brushed it off as pre-surgery jitters and continued with my preparations. The anesthesiologist, Dr. Patel, had already sedated Emily, and she was ready for the procedure. I made the initial incision and began the surgery. Everything seemed to be going well, and I was making good progress. As I carefully removed the inflamed appendix, I noticed that something wasn't quite right. I couldn't put my finger on it, but I had a nagging suspicion that something was off. I decided to double-check my work, and that's when I realized my mistake. In my haste, I had accidentally severed a small but critical blood vessel. Blood was pooling in the surgical site, and Emily's vitals were starting to plummet. Panic set in as I realized the gravity of my error. I called for assistance, and my colleagues rushed in to help. We worked feverishly to repair the blood vessel and stabilize Emily. Time seemed to slow down as we fought to save her life. Finally, after what felt like an eternity, we managed to stop the bleeding and stabilize her condition. Emily was transferred to the ICU, where she remained in critical condition for several days. I was racked with guilt, unable to sleep or eat. After a week of tense waiting, Emily began to show signs of recovery. Her condition improved steadily, and she was eventually moved to a regular room. I continued to visit her, apologizing profusely for my error and doing everything in my power to ensure she received the best care possible. Emily was discharged from the hospital a month after the surgery. Though she had made a full recovery, I knew that I could never truly make amends for the pain and suffering I had caused her. The guilt weighed heavily on me, and I vowed to never let such a mistake happen again. My story serves as a reminder that even the most experienced and skilled professionals can make mistakes. It is our responsibility to learn from these mistakes and strive to be better, to ensure that we provide the best possible care to our patients.